You're listening to the ADHD Heroes Podcast, a podcast where we speak with the heroes of the ADHD community, namely educators, mental health professionals, and of course, those with ADHD themselves, to gain insights, tools, and most importantly, inspiration towards succeeding and thriving with ADHD. I'm your host, Rabbi Shmuel Reich, a high school Rebbe and an ADHD coach in private practice. Welcome to the show. Hi there. On this week's episode, I spoke with Shimmy Feintuch, a licensed clinical social worker and addictions counselor. We discussed what an addiction is, why individuals with ADHD can be more susceptible to addiction, what treatment can look like, what coaches can do versus what requires a therapist, the importance of family members getting help and support, and a lot more. A couple of heads ups. As mentioned previously on episode 11 with Dr. Marcus, there are two calls that I get that I know I can't treat as a coach. One is failure to lunch, which is the subject of that episode, and the other one is addictions. In contrasting what a coach can do with what a therapist does, on this episode, I described coaching as providing hacks. While that definitely is what it looks like, there is more sophistication than that, as well as skill building, so just mentioning that to make sure I don't badmouth my own profession. Also, in discussing addictions, some sensitive topics come up that may not be age appropriate for young kids, so if you have them on while you're listening in the car or something like that, then make sure to have that in mind. Enjoy. Shimmy Feintuch, welcome to the ADHD Heroes Podcast. I'm excited for our conversation today.
Thank you. Me too.
Okay, great. So for starters, let's just talk a little bit about yourself and your background.
Sure. I grew up in Brooklyn, New York, what some people call deep Brooklyn, Flatbush, some people call it. Now live and practice in Riverdale in the Bronx, New York City. Professionally, I'm a clinical social worker and addictions counselor. So my areas of focus are addictions, so primary addictions work, either substance addicted or behaviorally addicted. As a subspecialty of that, I also work with family members of people affected by addiction, so spouses, parents, siblings, and I enjoy that work greatly as well. And a different specialty is couples work, just relationship counseling, and I enjoy that as well. My office in person is in Riverdale in the Bronx, and I'm also licensed for telehealth in New York, New Jersey, and Florida, which I'm told is the Jewish tri-state area.
Oh, that's good. I like that. Excellent. Okay. In layman's terms, what is an addiction, speaking of addictions?
Layman's terms is the way to go. The simplest definition that I've heard is from Dr. Judson Brewer, who's a addiction psychiatrist. He says addiction is continued use despite adverse consequences. So that can also include a lot of things that are not addiction, but it's just something conceptually to think about, continuing to do something even though you're getting consequences and you just can't seem to get out of it.
Interesting. Is there a certain threshold that needs to be crossed in order to...
So it's interesting in terms of diagnosis. The term addiction is not a diagnosis in the DSM, and I believe in the ICD-10 as well. Those are, you don't have to worry about what that is. But in terms of actual diagnosis, there are some thresholds, but they're pretty subjective. Like it'll have a mild effect in your life, a moderate or severe. So there isn't an objective threshold. What I usually tell clients is that I'm here to explore with you what role this substance or behavior is playing in your life and what consequence it brings. And if you want to discontinue doing that, I don't ever find it useful to tell somebody, you have an addiction, you need to do X, Y, and Z.
Oh, interesting.
Yeah.
Okay. Are certain people more susceptible to falling into addiction than others?
Yeah. For the purpose of this discussion, let's stay focused on mental health factors, even though there may be genetic and other familial pieces to it. But in the mental health forum, in the mental health arena, I should say, I would say people with anxiety are more susceptible, people with trauma, and I'm not talking about, that I dropped my ice cream and that was really traumatic for me, but bona fide PTSD. Yes, exactly. Capital T trauma and ADHD. I kind of call those, the big three in terms of more susceptibility to addiction. Some people are lucky enough to have all three:
Right.
anxiety, post traumatic stress, and ADHD. But ADHD is definitely in there.
Interesting. So, with that in mind, what's the increased statistical likelihood of someone with ADHD developing an addiction?
Yeah, you had sent me this question before, and I did like a deep dive into the statistics,
Oh, wow.
came up a little more confused than when I started. So,
Oh no, sorry.
research differs, but it appears the consensus appears to be that people with ADHD are about 2 or 3 times more likely to have a substance or behavioral addiction problem than people without ADHD.
Oh, interesting. Okay, so before we dive into the next question, just a little
Mm-hmm.
background. There are two calls that I get that I know I can't help people with. Number one is failure to lunch, which we have an episode on with Dr. Moshe Marcus, really good one. And number two is addictions. So the fact that I'm not trained in them is definitely one reason that I know I can't do it. But also the sense I get of things is that the there's a narrative and a psychology of an addict that's very deeply rooted, and it's not just, hey, I'm doing this thing, I wish I wasn't doing it, let's find a hack, which is a thing coaches do. It's definitely not some of that. Definitely like categorically different. So I guess the next question is, why is it more likely for people with ADHD to develop an addiction?
Yeah, and I appreciate your framing of it. Can I ask you a question on what you said before answering yours?
Sure.
Um, you view your work as hacking. I love the term, but can you say a bit more about that? Like if somebody comes to you with what might seem like something that could be coaching or something that could be psychotherapy, what where would you see your like hacking skills?
Where's that line? So what I tell people is, if we need to look under the hood, I'm not the guy. Um, what I help them with is to create strategies to do the things they want to do. Sometimes we'll look at thoughts and feelings on a pretty surface level,
Mm-hmm.
like CBT style. But as soon as we need
Mm-hmm.
to start digging and wonder where that came from and why they feel that way and all that,
Mm-hmm.
that's the job for the therapist. That's pretty much where I draw the line. And sometimes they can come
Okay,
up in session. It'll be
great.
like, why do you think I think that? I'm like, I don't know. Ask the therapist. There usually is a therapist also.
Okay, great. So you work in conjunction with psychotherapists as well.
Yeah.
Great. And the way you're describing it seems to me like it seems to me about how much I know about fixing my car. Anything under the hood.
Oh,
I
excellent.
should not actually. Went to a mechanic last week and I had trouble opening the hood. So
Oh gosh.
yeah, that should tell you. But gas, I got it covered. So to I guess use that to jump off into answering your question, what makes people with ADHD more susceptible to addiction? I have a few kind of like ADHD teachers or people who I kind of study their stuff. One of them is Dr. Ari Tuckman.
Oh sure.
Yeah, he's wonderful, and he has such a clear way of explaining things. So one thing that he said is that ADHD doesn't create new issues. What it does, it makes existing issues more difficult. Meaning, it's not that somebody with an ADHD diagnosis is going to contract some really strange, weird symptom that other people don't have, but really standard, run of the mill things like difficulty focusing, inattention, difficulty with organization, procrastination, lateness that we all experience in some way. Somebody with ADHD will experience in a much more severe way, in a way that will impact much more areas of their life. So, with that in mind, I kind of wanted to share a little bit of how I understand ADHD, and hopefully, this will be helpful for your listeners. And if not, then you'll edit it out, and we'll never know. So,
Perfect.
but this is how I think about ADHD, and certainly when I'm working with somebody who has both ADHD and an addiction, it really goes into explaining how this happened. So I share two different things. The first is that one way of understanding ADHD is that it's a dopamine deficiency. You probably have heard of dopamine. It's a neurotransmitter, which basically means a chemical in your brain. And it's really associated with how we learn and how we remember things. And the way I think about this is you go to the aquarium and you see the sea lion with the trainer, and the sea lion has figured out how to do all these amazing flips and jumps. And the way that it happens is you can see the trainer giving, after every trick, gives the sea lion a fish. The fish is the dopamine in our brain. The fish is the brain saying, hey, that was great, let's do that again. You did it. You did a project. You completed it. Wow, amazing. You smiled at somebody and they smiled back at you. You get some dopamine. You get some other neurotransmitters as well from that one. But you checked off a task on your list. Little dopamine hit because the brain is saying that was good. I want you to remember it. So dopamine is associated with learning and memory. And if there isn't enough dopamine in the brain, like there isn't enough gas in the car, we're going to have to try harder to try and do a task. Meaning, if I have ADHD and you do not, then when you do a task, you feel level 100, and when I do the same task, I feel much less. I don't know, level 50 or level 10. So I'm going to have to work a lot harder and get a lot less satisfaction. The other metaphor that I use besides for the sea lion is like you're riding a bike with not enough air in the tires.
Oh, that's very
For
good.
some reason, I'm just working harder and it looks like everyone's just cruising along, but here I am sweating and I'm not even finishing first.
Right.
So if that matches, like sometimes that can be really, really helpful for people. So what that means is that people with ADHD are more likely to feel bored because you'll do the same task and it just won't feel as good. People with ADHD will have more difficulty sustaining a task, continuing a project, or completing a project because that takes a really sustained effort. People with ADHD are more likely to procrastinate because all those things are related to dopamine, the reward system in the brain. So there's a lot of difficulty there already. And just think about, just from a mental health perspective, what happens here. It can really seem like there's something wrong with you. You can feel lazy, right? There's that word that gets thrown around a lot.
You know that book, the lazy, stupid, crazy book?
Yeah. That's a good one, right? So,
Very good. Very good.
I actually say this to clients a lot. I don't believe in laziness. I don't think that there is such a thing as objectively lazy people. What we're usually doing is calling something lazy that's really better explained by ADHD, inertia, something that needs more like habit hacking, as you would do. So there's a lot that isn't really explained by the word laziness, and then it's just moralizing. So people with ADHD, because of these things, will be more likely to feel some sense of low self-esteem. I'm lazy. I'm not good enough. I can't follow through. I can't complete the task. I'm dumb. I'm not smart. And we kind of reinforce this. Like, if you really cared, you would be on time. Right. Or that thing that people get in first or second grade. You're like, why are you having such a hard time with this, religious subject? And with baseball, you can remember all the things. It's like, well, okay, because baseball is a great dopamine hit, and religious stuff maybe less so. So people are much more likely to feel. People with ADHD are more susceptible to feel shame, low self-esteem, depression. And if you don't feel good about yourself, and then there's something that helps you feel good, you're more at risk for that. You can't get stuff done, and then here's this substance that helps you get stuff done. I have a number of people with ADHD and addiction in my practice, and sometimes, stereotypically, people will be addicted to stimulants because the medication for ADHD is usually stimulant class.
Right, sure.
So, yeah, you're more addicted to cocaine because that helps you get stuff done. A dopamine deficiency also means more susceptibility to intense substances or behaviors, easier dopamine fixes. It's just a lot harder with ADHD to get the more complex satisfaction of accomplishing something that you worked really hard for. So the short-term things are going to be easier. So all those things kind of combine to people who are more at risk for something to come in and make them feel better, make them more productive, and just help them be a functioning member of society.
It seems like there's always this narrative, and I have no idea like what it is and where it comes from. That addicts seem to struggle with. Like there's an old joke. How do you know an addict's lying? You know this one?
Yes.
Yes. Okay. So what I guess what are the cliff notes on that?
Yeah. For the listeners, the joke, which I really hate, is how do you know? It's not a joke. It's a slogan by now. How do you know an addict is lying? And the answer is when his lips are moving. Yeah, I mean it's moralizing. It's really judgmental. It's harsh and it's completely unhelpful. But just think about what happens when you continue that definition from before, continued use despite adverse consequences. When you really continue to do something, even though the consequences are getting greater and greater and greater, your sense of yourself is going to be pretty poor. You're going to really not feel good about yourself. So that's, like I said before, with the ADHD doesn't create new things; it just makes things harder. This is one of those examples. Anybody with addiction is likely to not feel good about themselves. People with ADHD even more so.
Interesting. So, like part of the in the therapy work, they're going to be working through all that. They're going to be working through why they feel that way. You know how it ended up that they felt that way, rebuilding their self esteem.
Yes, but the early addictions work is much more related to getting healthy, getting to a place where you're no longer doing the unhealthy thing, or if that's not your goal, to completely be abstinent, getting to a place where you're really reducing the harm that thing is doing for you. Usually, the why questions are not useful at the beginning. This is a mistake that some like I would say newer clinicians make in terms of addiction, because the why is always interesting. But it's not a good use of time at the beginning. Once somebody has reached a certain level of stability, then yes, it can be useful to kind of go deeper and see how this happened, and can we do some deeper work to help it be less likely that you'll get back there.
Right, interesting. So, how does that the process of stabilizing like differ from hacks? We'll say.
There are parts of it that are similar. There are when we're getting very, very behavioral, right? When we're saying, well, why don't you, put meditation in your calendar instead of just hoping that you're going to do it? Yeah, there isn't a lot of difference in that. A lot of times when I work with people who have ADHD and addiction, I often will refer to a coach, because I actually said this to a client today. We just started. You're seeing me twice a week. It's not a good use of our time. We're working on stabilization. It's not a good use of our time to get nitty gritty about, why you have trouble turning off work at 10 p.m. What we can do is we can talk about why you're having trouble with setting that boundary of work at 10 p.m. But in terms of like how you want to fill in your calendar, how you want to kind of hack, like you say, that your behaviors to make it more likely that you'll be able to meditate, and make it more likely that you'll be able to, call your sponsor if you're going to a 12-step program. A lot of that is we would kind of get into the weeds with it. And I want to work on more of, there's trauma related stuff there that was making things difficult. I wanted to get more into what happens when you do stop work and you just feel like you don't want to just sit with yourself. So maybe if I can summarize and more directly answer your question, there is very, very behavioral work that I would do, that I would say a coach can do just as well, perhaps even better, if it's very, very nitty gritty. But what I would add to it is, just for example, the trauma piece. If somebody's having trouble hacking, then there's usually an indication that there's something else there.
Right. Right. Yes, I generally assume that that's what's happening with anybody who has an addiction. Is that a safe assumption? That there's something there more than just the behavior that they don't want to be doing?
Usually, with addiction, it's rarely just hacking. Usually what I find is that if it was simple enough, people would have stopped already. People usually come into therapy after really, really trying to stop for a very, very long time. And having, they'll have hit the self-help section in the bookstore, and they'll go to websites, and it happens a lot where people with compulsive pornography use will have tried this website and that website and this filter and some other things and some religious ideas, and then they come in at a loss, like, hey, I tried a lot. I usually find that.
Are these things that are getting in the way? I guess this narrative or psychology or whatever that's whatever's under the hood there, do they tend to be what you were describing before, the not feeling good about themselves, or is there more to it than that? That's a common sort of thread.
It's really, really broad. I have a presentation on kind of like addiction theory, and there are a lot of different schools of thought. The short answer is that there are a lot of factors, and those are only a small slice of it. Those are maybe some of the more common ones, but just for example, something that I didn't mention at all, there's a really strong connection between depression and alcoholism, alcohol specifically. So that's something that can really develop and snowball. There are a lot of genetic factors. There are societal factors. There are family and upbringing issues that can lead people to be more susceptible to addiction. There are attachment issues. I'm just kind of mentioning things that listeners can dive into if they want to. But yeah, it's a slice of it. It's a big slice, but it's just a slice.
Interesting. Okay. Is there a common denominator? Is it the numbing factor of it, or the dopamine factor of it?
We don't know enough about how the brain works to really answer that. What we know is that the common pieces diagnostically are the continued use despite adverse consequences. Or there's, we can get more into the nitty gritty of diagnosis. There's something called tolerance, which is needing more of the same substance or behavior to get the same effect, or using more to get the same effect, or when using the same amount, getting less effect. There's withdrawal. There's a loss of control. Those are the common factors. But in terms of common sources, I would say there's not.
Oh, interesting. Okay. Bringing it back to ADHD.
Yes.
Are there any is there any particular type of addiction that's more common for those with ADHD than for others?
It's interesting. You'd think it would be researched, but it's actually a research gap. There doesn't really seem to be a lot of data that suggests that. Anecdotally, I can say that people with ADHD are more likely to turn towards stimulants because of just how the brain works. That the executive functioning, which is lower in ADHD, will get stimulated by things like cocaine and other stimulants. And then what sometimes happens also is people will tend to stimulants that are not as strong as cocaine. So things like nicotine or caffeine. And then people will kind of say like, oh, well, I'm not medicated. Like, well, you kind of are. You're having 10 coffees a day. So that's interesting. And another piece more common with ADHD, although common in general, but more with ADHD is screen use. Because screen use provides a really easy access to dopamine. Can nerd out a bit more about that if you want. But people with ADHD are more likely to get hooked on screens.
Interesting. What are substances that people get addicted to that don't have dopamine, that like aren't stimulants? I mean, just for contrast.
That aren't stimulants, sure. So sedatives like Xanax, stuff like that. Narcotics, so opioids like heroin or any kind of oxy, that kind of stuff. Alcohol is a sedative as well. Marijuana is a complicated drug that has some stimulating factors, but also a bunch of other things. There's a whole class called inhalants, which are kind of like noxious gases, and those aren't necessarily stimulating.
Got it. Okay. Mm-hmm. How do addictions and ADHD affect each other? And when we talk about treatment.
Yeah. So I kind of keep coming back to the ADHD is like everybody else, just more so.
Right.
That there isn't anything truly unique about ADHD in terms of the treatment of ADHD and addiction, but it does make some things a lot more difficult. It is a lot harder. And we will talk about things like we're talking about integrating healthy habits, like going to a 12-step meeting and making sure you get enough sleep and exercise and eating right, and like just some kind of the basic things. But people with ADHD will have a more difficult time with that because it requires executive functioning. It requires, sustaining tasks and being consistent. and organization, and all those things are more difficult with ADHD. So I usually spend a lot of time educating about that, like let's understand why these things are more difficult, and to give people more support, which is really where like a coach can really shine, because I'm not set up to take a call or a voice note from a client on a day that we don't have a session, or at a time that we don't have a session. But somebody who's a coach can really say, like, somebody's like, hey, I'm really in the weeds in this project and I lost focus, and I'm, it's 5 p.m. and I didn't get any of my stuff done. Can you help me sort myself out? And that's something that, a coach can really help with. So getting adequate support is really important.
Right. How do the how does the ADHD medication like factor into this picture?
Medication is important. So people who are medicated for ADHD will almost always be on a stimulant, and those are addictive medications. So it really needs to be closely monitored. I would say that anybody who has both ADHD and an addiction, even if it's just a behavioral, meaning a sex addiction, gambling, whatever, but certainly a substance addiction, should only be going to a psychiatrist who's knowledgeable about addiction as well. Because if you're knowledgeable about it, you'll look for potential abuse of the medication, like using it too much, like, oh, you need to refill that soon, like, oh, why is that? And really trying to prevent abuse. I would say that's the biggest factor. There are non-stimulant ADHD medications. They really don't work as well. So there are some people who kind of choose to not go on stimulants because they don't want to be on something that's addictive. And I would say it just means that the onus is more on you for the behavioral change. It's really, really tough. You need as much support as you can get.
Interesting. You see that see that commonly? You see
Which
people
part?
addicted to addictions to the stimulant medications?
Yes. Yeah. And I mean, I'll give you an example. The for Adderall, the maximum daily dose depends who you ask, either 45 or 60 milligrams a day. I mean, I had somebody come in who was using 300 milligrams a day, which is a major problem, and a health issue. But yeah, I've had clients who convince their psychiatrist that they're going to get the maximum allowable dose, and then they will, use it more frequently, and then run out a week early, or start buying drugs on the street, like Adderall on the street, to supplement with it. Yeah, I would say you really need to have your eye out for that. Otherwise, it will happen.
Okay. What are early warning signs for oneself or family members that somebody might be heading down the road of addiction? And is there something family members can do about it?
Mm. Yeah, I very rarely get the call, hey, I have an addiction and I want help. Can I schedule an appointment?
Right.
Sometimes it's people calling in crisis, and that will get somebody in the door. But more often than not, it's my husband or my wife or my parent or my child has a problem. Can they see you? How can we get them in? So I want to really say that first, that a family member is really eligible, deserves the help, and to get their own support. And sometimes it really does become that, where I see somebody as an affected family member, and whether or not their loved one gets help, their life is improved. But for the people who want to keep an eye out for their loved ones, I guess some things that I would keep an eye out for, anything like secrecy, hiding. No, you can't look at my phone. Where were you? I don't want to, why are you asking me? Some kind of defensiveness. So secrecy, lying, changes in behavior, especially like, oh, he's very tired all of a sudden. His mood is really different. She used to be so social and now she's not. Periods of time they're unaccounted for. That's something to look out for as well. But you can't always know. For kids and teens and young adults, so like for parents asking about children, I would say similar to mental health, the best prevention is education. You really want to be kind of open and sharing about risks, and talk about drugs age appropriately, talk about internet use, talk about gambling. Sports gambling is really having a moment. So talk about these things, educate, teach moderation, teach healthy use, and a really healthy balance of love and limits in terms of parenting. But those are just some things to keep in mind.
Wow, okay. What tend to be false alarms that get family members nervous, but they can relax?
Yeah, that's a good question. So doing something once or even twice is not indicative of a problem. We look at patterns, right? Remember the definition from before: continued use despite adverse consequences. You keep doing it. So if your teenager had a drink of alcohol or even got drunk, that's not good, but it's not an addiction necessarily. If your I don't know what your spouse used a drug, like, oh, all of a sudden she wants to use marijuana, but she's a drug addict, something like that. And even behaviorally, porn use is not necessarily indicative of an addiction. Even infidelity, while it's a problem, is not necessarily indicative of an addiction. Gambling may not necessarily be. It's about the big picture. It's about the pattern. So what I guess I would like to say is, like, let's kind of step back from like an alarmist view, like, oh no, do you know what she did? Do you know what he did? That can be a problem. That can be something that you need to address, but it doesn't necessarily mean that it's an addiction. It could be something different. I read this study a while back that I thought was very eye opening, just in terms of porn use. That religious people, are more likely to call their porn use an addiction.
Oh, interesting.
Yeah, so it is interesting. So yeah, and you have, like, anecdotally, I can tell you, I do have some clients from Lakewood, South Jersey. There's a bit in some of the 12-step programs there. There's a bit of like an admissions process that you have to kind of, I guess, prove that you really have a problem. Then it's not just something that's causing a bit of a problem in your life.
Right. Interesting. Okay, as we're starting to wrap it up, what's a message of hope you want to give our listeners?
People ask me why I do this work, because addictions work can be very intense, but I really love it because when addiction treatment is successful, people can make significant, really long-lasting changes in a relatively short amount of time. That the terrible pain that people come in with really helps motivate people to change. Real change takes a long time, and addiction recovery, over the full recovery picture does take time. But I did work for a bunch of years at an addictions clinic in Brooklyn, and we would see people for 9 to 12 months, and the hope was that people would come in crisis and walk out not finished, but walk out completely different people after 9 or 12 months. And that level of change in that relatively short amount of time is I think part of the beauty of addiction recovery.
Wow, that's cool. Okay, anything else you want to share about addictions and ADHD today?
So much, but short, concisely, I would just say, if you're someone who's unsure if you have an addiction, or you're unsure about a behavior or a substance that's creating problems for you, get some help. There's nothing wrong with that. Even if you don't have an official diagnosis, your life can get better. And like I said before, if you're affected by someone else's substance use or problematic behaviors, you deserve to get help as well. Your getting help may help your loved one, but even if the person in your life never changes, your life can change significantly for the better.
Wow. Okay. How can people get in touch with you?
Let's see. Probably the best way is to email me. I'll say my email and spell it out. It's just my name, shimmyfeintuch@gmail.com, shimmyfeintuch@gmail.com, or through my website. There's a contact form at shimmyfeintuch.com, or you can just Google me and it should come up. There's a contact form through there. And on the off chance that I don't get back to you in what you feel is a reasonable amount of time, then reach out to me again. And I try to check my spam email as well.
Okay, great. Thank you so much. I learned a lot today. Hope listeners did too.
Thank you. Thank you, Shimon. Thanks for having me on.
Thank you again for listening to this episode of the ADHD Heroes podcast. For questions about the podcast, you can email us at adhdheroespodcast@gmail.com. Also, for sponsorships or to share your story, your ADHD story, you can also email us at the same place, adhdheroespodcast@gmail.com. To be in touch with me about ADHD coaching, writing, or speaking engagements, you can email me at rsreichadhdcoach@gmail.com. Be sure to check out my website, rsreich.com, adhdcoach.com. You can follow me on LinkedIn, or you can check out my blog on nefesh.org. Check out my blog there under my name. Important disclaimer: podcasts are great, but they do not take the place of mental health help or medical help. So if you need help with mental health or need a doctor, be sure to be in contact with some of them. Please, if you like this show, please rate, review, and share with a friend. That's how these things get out there. Thank you again for listening, and thank you to our producers at Pretty Easy Podcasts.